Hey, happy Friday, everyone. Hope that you guys are doing amazing. Okay. Definitely want to talk about a really important topic today. I want to talk about the risk factors of having a myomectomy. Okay. So if you're watching this live on the replay, definitely hashtag replay and definitely share the live because this definitely could, save a life, save a uterus. All right. And I know that a lot of people aren't aware of the risk factors of myomectomy because unfortunately we're not told this by doctors. And I'm speaking, from the lens of a holistic woman wellness specialist, okay? Also from somebody that's had a myomectomy in the past. So that's why I really want more and more women to know this information, okay? So be sure to share this information, share this live because so many women, unfortunately, have fibroids, especially Black women. We have about 80 to 90% of Black women who will get fibroids before the age of 50. I say that all the time, but I want you guys to know how serious this is, okay? So if you're not into holistic health, then probably isn't the life for you because, of course, I approach things from a more holistic lens, okay? So when we're talking about surgical intervention for fibroids, it seems like the best alternative because, unfortunately, and if you guys can hear me, put a 1 in the chat, okay? Hey, everybody that's coming in, put a 1 in the chat if you guys can hear me. So, it seems like the best alternative. It seems like, quick fix, I could just do the surgery and then, my fibroids are gone, my suffering is gone. And I definitely understand what you're going through. Like I said, I've been through this myself. I've gotten fibroids twice, and I'm gonna go into that a little bit later. I've tried it the surgery way, and I've tried it the holistic way. All right, thank you, Jasmine. Hey, Jasmine, hope that you're doing great. Have to message you because I know we talked a few days ago. Message you, make sure that you're okay. Hey, ladies, make sure you guys sharing the live. Okay, thank you so much for coming in. But yes, so when we talk about, I want to tell you guys about the hidden dangers, the dangers that they don't talk about when it comes to a myomectomy, okay? Because I was told, oh, it's going to be an easy surgery. Everything's going to be fine. It's going to be like, you're going to be home the next day and you're going to be back to work by the next week. And that was not the case, okay? So it's been marketed myomectomy has been marketed as a saving grace to women with fibroids who want to have children later on because it's like supposed to preserve the uterus, right? So you're supposed to be able to take out the fibroids and preserve the uterus, all right? But not only does it have risks associated with it, it also, again, I always say this, it does not come, it does not get to the root cause of the problem. And it could be a very invasive and dangerous surgery, okay? I've talked to so many women who've had myomectomies. I've went through my own experience. So I definitely, have a lot of information about this. I've gathered a lot of information about this. I've done research. Okay, so let's talk about a myomectomy. If you've had one, you could share your experience as well. I would love to know, if you've had a myomectomy. And we can get started. So in case you're new to me, my name is Sasha Rosa. I'm a holistic women wellness specialist. And what I do is I help women who have reproductive health issues, fibroids, infertility, PCOS, endometriosis. I help them engage in healthy habits in order to heal their wombs, in order to heal their bodies. I help them restore balance restore balance back into their hormones, their body, in order for their body to do what it's designed to do. Because when we're in balance, when our body's in balance, then your body's going to do what it's designed to do, okay? But now when we're out of balance, when our hormones are out of balance, this is when we start getting these reproductive health issues, okay? So let's talk about it. So let's talk about a risk factor for a myomectomy. First is the complications. How many women have had myomectomy have had complications? Like the number is just, I've had complications during my surgery. So many women have had complications. So whenever you're cutting into the uterus, there's a risk for bleeding, excessive bleeding. There's a risk for, scarring, uterine scarring, which is a big one, which is actually really common when we're dealing with myomectomies, especially for women who's had multiple myomectomies, okay? Because you got to understand, like, if you're cutting into the uterus, there's the risk factor of damaging the tissues, the surrounding tissues. And we're talking about the uterus is lined with cells and tissues, right? So whenever you're cutting into the uterus, there's a risk of creating uterine scarring. And whenever we're dealing with uterine scarring, that is when, it's not easy. We can't, it could be something that is really hard to get rid of. I know doctors, do surgical procedures for uterine scarring. However, sometimes it comes back, okay? I've had a client that, by the way, my Detoxify Your Womb client was able to get rid of uterine scarring naturally, okay? In our program, just want to let you guys know that. But they do have procedures to also to get rid of uterine scarring. But unfortunately, they may not be successful long term. That's the issue. Now, here's the issue with the uterine scarring. It may prevent you from, it may prevent you from having children later on. It may interfere with your ability to conceive. It may cause miscarriages in the future. So that's another problem dealing with the myomectomy, right? And people get the myomectomy in order to, for the most part, preserve their uterus because they want to more than likely have a child in the future, right? So then you're telling me that there's a risk factor that this surgery may cause uterine scarring. You guys need to know this. This is something you guys need to know. I had a client, had 2 myomectomies, uterine scarring. A lot of women have had multiple myomectomies. This is not uncommon because they come back when you don't get to the root cause of the problem. The fibroids come back. So it's really scary, because when we're dealing with uterine scarring, again, it can affect your ability to get pregnant, right? So we definitely don't want that. We don't want something that's going to cause infertility and miscarriages in the future or other, problems as well. So you have to be really careful. It may affect your ability to be able to carry a pregnancy to full term, okay? Also, too, when you're dealing with a myomectomy and you're dealing with cutting into the uterus, you can lose, there's a possibility of excessive bleeding. How many women who have fibroids, are anemic? Most women who have fibroids are anemic already, right? So then the surgeons always tell you guys in the beginning, because they told me when I was when I was about to have a myomectomy, right? They actually told me this at the last second. If there's a risk factor for you bleeding, bleeding too much during surgery, we might just remove the whole uterus. We might just perform a hysterectomy. Do you know how scary that is? So a lot of women have gone in for a myomectomy and had hysterectomies because of excessive bleeding. That is a risk factor because especially if you're already dealing with anemia, it's a huge risk factor if they're cutting into your uterus that you may excessively bleed. So a lot of women have went in for thinking they're just getting their fibroids removed, but then they, when they wake up, they say, well, we have to take out the whole uterus because you were bleeding too much. This is not as uncommon as you think, okay? So especially when we're dealing with Black women, let's be honest now. We don't get the best health care, okay? We don't get the best treatment when it comes to health care, okay? So that's a huge risk factor. This surgery may cause excessive bleeding. It may cause uterine scarring. You don't know. Many women have had major complications with a myomectomy, okay? I've actually had a client as well, they didn't just, cause uterine scarring. Also, too, the surgery caused one of her tubes to be blocked. So there you go. Okay. So another thing is fibroid reoccurrence. This one is not even a risk factor. We're talking about more than likely because we're not getting to the root cause of the problem. A myomectomy does not solve the problem. It will cause, you will have temporary relief from the bleeding, from, feeling all the fibroid symptoms that you were feeling before, from the frequent urination, depending on what symptoms exactly that you're having, because everybody's symptoms is a little bit different, right? But, women are desperate for relief. And when I was having when I first had my surgery, I was desperate for relief before that. So I totally understand, so this is marketed as something that's going to solve all your problems, but they don't tell you, hey, there's a huge chance of those fibroids coming back. Because you didn't do the work to get to the root cause of what created the fibroids in the first place. The fibroids did not just come from nowhere. There was a reason why the fibroids developed in your body. It's not that it's genetic. You may be more predisposed to fibroids if you have fibroids a lot in your family, but there's a reason why they developed in your body. It didn't just come out just because, right? There's a reason, and it's been developing in your body for a long period of time. You just didn't notice the first signs of fibroids. You didn't notice the first signs of, you developing fibroids. You didn't notice the first signs of a hormonal imbalance, right? Because when the body's out of balance, this is what happens when, our estrogen is too high, for example. And this is when we can get endometriosis, we can get, fibroids and other autoimmune disorders even. So it really goes deep with that, right? So I want to tell you guys this. There was a woman who was following me who got a myomectomy last December. By May, she already had a 5-centimeter fibroid. When I had a myomectomy, my fibroid came back, okay, a few months later. I was, again, feeling the symptoms of a fibroid. Then I went to get checked. Mind you, another fibroid. This is very common, and it's very scary, right? You're going into surgery thinking that, all your problems are going to be solved. It's going to take away the fibroid, and it does. But then shortly after, you grow another fibroid. Do you know how traumatic that is? I was on a podcast yesterday. You know, shout out to those ladies. Actually, it was on Wednesday, and I posted it yesterday. We Talk Back podcast is very popular, okay? Shout out to those ladies. One of the hosts on the show had a myomectomy. She had a fibroid removal surgery. What was it, in March? She's saying right now, she's starting to feel the signs that the fibroid's back. All the symptoms that she was feeling before her surgery for years, she says, I think it's back. I'm about to get, you know, and, you know, we asked her, are you going to have another surgery? She said, hell no, because the first one was horrible. And I could totally relate to that because that was my position. I was like, I was not going to have another surgery because it was so bad. I know more women who's had multiple myomectomies, right? You know, so the surgeon is, you know, cutting into your uterus every time you have a myomectomy, there's an imprint there, right? It leaves imprints in your uterus and it can create scarring. So it's not just like you just having a myomectomy, that's it. No, right? You're lowering your chances of being able to have a, you know, a child, you know, being able to get conceived naturally every time you have a myomectomy. And some people who don't want children may not care about that, but do you really want your uterus all cut up like every couple of years because you haven't done the work to get to the root cause of the problem? No, right? I would hope not. Also, too, it's a longer recovery time. You know, a lot of doctors don't talk about this part. There is a recovery time when it comes to myomectomy. I was told that next day I was going to leave the hospital that night or the next day. That didn't happen, right? I didn't leave the hospital until 5 days later. You know, it was the worst recovery. It was horrible. You know, I went back to work, I think about a month later. I did not expect that. The recovery period was horrible. My mom had to take care of me. Had to, even after leaving the hospital, still couldn't function by myself. So it took a couple of weeks before I was able to do things for myself. So you just have to keep that in mind whenever you're going to get these surgeries. They're not just a quick fix, ladies. It's not a quick fix. A lot of doctors make it seem like it's very painless. You know, you're not going to feel nothing. That was the worst pain I've ever felt in my entire life. Like, it was horrible. My pain tolerance is not that high, but it was really bad, ladies. It was really, really bad. I wouldn't wish that type of pain on my worst nightmare. And they was giving me some weak painkillers too, but that's a whole other topic. Now let me talk about how when you're talking about a myomectomy, you could cause damage to your lymphatic system because you're cutting through your lymph system whenever you're having a surgery, right? So when you have fibroids, you already have stagnation in your lymphatic system. And we should know by now the lymphatic system is the body cellular waste system, right? It helps the body remove toxins. It removes toxins, excess fluids, and excess mucus from the body, right? It's a critical part of your immune system. Your lymphatic system is very important. And when you have fibroids, that lymphatic system is congested, okay? So you have lymph nodes. The lymphatic system is filled with lymph nodes and lymph vessels. Now, whenever you have fibroids, right, you have lymph nodes around your reproductive area that's congested, that's blocked. So your lymph nodes around the reproductive area is for keeping your reproductive system healthy, right? So when you have fibroids, when you're dealing with heavy bleeding, when you're dealing with, you know, endometriosis or cysts or things that are affecting the womb, that means those lymph nodes are not doing the job they're supposed to be doing, right? They're supposed to be filtering out the toxins from that area. And they're blocked, they're congested. So you're dealing with stagnation. The lymphatic system is not, moving the way it's supposed to. The body's not flowing the way it's supposed to, right? So what happens is when those lymph nodes are blocked, those toxins are dumped back into the body, right? And they create fibroids. So that's another reason for the bloating around the lower belly, because the swelling, your lymphatic system is trying to send water to that area, fluid to that area to resolve the issue. That's the reason why a lot of women that have fibroids have a lot of bloating issues. Like some are even ongoing all the time, like they're dealing with bloating around that area, right? So what surgery does is it causes damage to the lymphatic system because you're cutting into the lymphatic system. So you're damaging your lymph vessels, right? So it's traumatizing the lymphatic system. And you're already have an issue with your lymphatic system when you have fibroids. And then the surgery on top of that is damaging that area. Okay, that's why a lot of women who had a myomectomy, right, they say that the scarring, the kind of like the fat kind of sits on top of the scar. And that's very hard to get rid of. Okay, so just think about it like that. Just think of it like that. This is not a long-term, a myomectomy is not a long-term solution. It's not. And to me, if I could go back in time, I would definitely never have a myomectomy ever. It was one of the worst decisions ever. Because again, I got fibroids a few months after and did the work to heal myself to get rid of those fibroids. It took time now. It wasn't easy now, but it was more than worth it, right? I have not had fibroids since, okay? So I want to let you ladies know that's watching this video, okay? You are worthy of real healing. A myomectomy is not real healing. This is a short-term, solution. What's going to happen in 10 years? Because guess what? We have women that's in their 70s, post-menopause, that's suffering from fibroids. We have little girls that's 15 suffering from fibroids. It was one girl on my TikTok, her mother said that her 15-year-old daughter had a 20-centimeter fibroid. 15. And between the ages of 15 and 25, for black girls, 25% of those girls had fibroids. Between the ages of 15 and 25, 25% of black girls have fibroids. That's a huge number. That's 1/4, okay? And they haven't, 15 to 25, like, come on, y'all. This is crazy. So are we going to tell 15-year-olds to have a myomectomy? Are we going to have 15-year-olds go through surgery? I had one girl that was following me that I think she had her surgery like around before she was 18. And her fibroids were back. So ladies, we got to stop this craziness, this surgery craziness. Every woman their first thing is surgery when it comes to fibroids. I know that you've been indoctrinated. I know the doctors told you that, this myomectomy is going to save your life, but that's a damn lie. As somebody that's been through it, that talked to many women that has had multiple, it's not going to save you, okay? So you deserve real healing. You deserve to get to the root cause of the problem. You deserve that. You deserve that. You deserve that. You got to think 10 years from now. 10 years from now, what's going to... Okay, it's back. Sorry, I had a poor connection. You got to think 10 years from now, what's going to happen, right? What's going to happen? Are you still going to have these same issues? Are these fibroids going to come back? But if you do the work to heal yourself, you don't have to worry about that. You just have to continue, be consistent and be disciplined and continue on with your journey. And it gets easier as time goes on, okay? So again, a myomectomy doesn't get to the root cause of the fibroids. It's a temporary fix. It's like putting a bandage on a broken arm, right? It doesn't make any sense. So the correct approach is for you to get to the root cause of the problem and to have a targeted, holistic wellness plan that's customized to you on how you're going to get rid of fibroids. Because people have told me, well, I tried the natural way. Okay, what did you do? Something, they may have read online or drink this tea or drink this herb, but they don't talk about like really changing their diet, getting to the root cause of the problem. They don't talk about, hey, healing, past trauma. They don't talk about, lowering their stress levels. They don't talk about none of that, right? So if you don't know what you're doing, then of course it's going to be difficult for you to, get rid of your fibroid and get rid of your fibroid symptoms, right? You got to actually know what you're doing. You can't just read about some herb and think that that's going to get rid of your fibroids, tumors in your body. No. Okay. And you're talking to somebody who's helped multiple women get rid of fibroids. Just had a client get rid of 3 fibroids. Okay. That she went from 4 fibroids to 1, and the one that's left is less than a centimeter. Just had another client got rid of a 6-centimeter fibroid within 3 months. Okay. In the Detoxify Your Womb program. These are my Detoxify Your Womb clients. Okay. And I've also had even people that take my courses, shrink their fibroids and feel so much better. Okay. So it's time for you to prioritize your health and take your health seriously, because when your uterus is out of balance, when your uterus are filled with fibroids and cysts, that affects your whole body. It's not just, it doesn't just affect your uterus, it affects your whole being, because your hormones are out of balance when you have fibroids, right? So that affects everything, right? That's why women that have fibroids, they have other health issues, right? They have gut health issues. Some of them get autoimmune disorders. Some of them get also endometriosis, another estrogen dominant, reproductive health issue, right? So it's an ongoing thing when you have fibroids and you don't, again, resolve it and get to what caused the fibroids, what created the fibroids in your body in the first place. It didn't just come out of nowhere. It didn't just come because you're unlucky. No, there's a reason why it developed in the body, whether it's your diet, whether it's your hormone levels, whether it's stress, whether it's being on birth control for 10 years. There's a reason why the fibroids develop, and you have to get to the root cause. That's your job to do that, right? So for ladies that are listening to this and you have fibroids or you have endometriosis, you're dealing with, all these symptoms. You don't know what to do. You don't want to have surgery, because there's a lot of women who's told me, look, my intuition is telling me not to have surgery. And I saw your video and that was like that clicked for me because I was like, you know what, this is my sign not to have surgery, right? Because there's women that don't want to do it. There's some women that's running to it, and I know there's a lot of women out there that's like inside they don't want to do it, right? They've been told this is the only way to get rid of fibroids, but a lot of women inside they don't want to do it. Who wants to go under the knife when you don't have to? Really? So if that's you, then make sure, I would love to have you my Detoxify Your Womb program. It is a 3-month program where I'm working with you and it's customized to you and your needs. Okay, on shrinking and eliminating your fibroids. We're getting to the root cause of the problem. You know, we are helping you heal, okay, from on a cellular level. So we're helping you rebalance your hormones, flood your body with, hey Marsh, flood your body with nutrient-rich foods, get your body to the point where it's detoxifying itself every single day, right? So again, we can get rid of that stagnation in the body, okay? We're balancing out those estrogen levels, so your fibroids can be able to shrink and you can get rid of them, right? So, and people tell me within 30 days even, to 45 days, they feel so much better. The bloating goes down. They feel like much more confident and just much more healthy. Like women that are dealing with heavy bleeding, they're able to see results, you know, within their menstrual cycle, within the next menstrual cycle, they're able to see that it goes down, the bleeding goes down, and it's a much better cycle, right? They're able to see that within, you know, the next cycle. They're able to see like their iron levels go up. And again, they start to feel more energy, right? This is your body's healing. This is the process your body has to go to because fibroids drain the life out of you. You know, it takes your iron, your minerals. These tumors wreak a lot of havoc in the body. You see a lot of women, they're just going through life, you know, trying to get through the day, and they're just so drained because they got these fibroids. I'm telling you, I know what it feels like because I've been there. You deserve better than that. You don't deserve to have a womb full of fibroids. They don't belong in your womb. They don't belong there. You deserve better, okay? Your womb deserves better, okay? And this is, again, when you have any type of womb health issue, that's a reflection of your health, your current health status. So again, as you heal your womb, you're also not just improving your quality of life, you're also extending your life as well. You're extending your life as well, okay? So it's deeper than just, okay, we're getting rid of these fibroids. You got to get to the root cause of the problem of what created the fibroids to occur in the first place. If you're not doing that, then prepare to have them come right back, okay? Not my period this month was less clotting, not feeling weak. That's great, Marsh. Okay, good job. Happy to hear that. So, ladies, you have more control over your health than you think. Much more control over your health than you think, right? It's not just the devil making you have fibroids. No, it's you and your habits, okay? You and your habits, your bad habits that need to be changed. And if you need help, I'm here to help you. Check out my Detoxify Your Womb program. The link is in the bio. Okay, make sure y'all also share this live. More women need to see this. More women need to know that, look, the myomectomy is not the saving grace that you thought it was. More women need to see that, okay, this myomectomy, what's the point of having it if it's just going to come right back, right? If you're in a room with 10 black women, 8 of them are going through fibroids. And some of those 8 probably don't even know that they have fibroids. So share this live, so this can save a life, because fibroids are destroying the lives of black women. Trust me, as somebody that's a holistic woman wellness specialist that's been through fibroids herself, okay, that talked to many, many women, fibroids are destroying a lot of women's lives behind the scenes, okay? So, ladies, okay, it's time to do the work to get to the root cause of the problem. You have more power than you think. You can heal your body. Your body is a self-healing mechanism. You have to just get the hell out of its way so it can do what it's supposed to do, okay? All right, y'all. I understand how heavy clotting feels. I had to call out a few months ago. Fibroids are no joke. Yeah, Marsh, fibroids are no joke. They're no joke. They disrupt your life. They disrupt your work life, your relationship life, your sex life, your dating life. Okay, you going on vacations. You know, you going out with friends you got to worry about. It's just too much. You know, I'm getting nightmares, thinking about, even anxiety, thinking about what I had to go through before for many years. You're literally lowering your quality of life. It's horrible, okay? And you're worth better than that, all right? So thank you for all the info. You're welcome, Keena. You're so welcome. So I want all of you ladies to heal from fibroids. Stop relying on these surgeries. They're not going to heal you. I want you guys to get long-term healing, okay? Be healthy and happy happy uterus, okay? All right? So if you want to check out the Detoxify Your Womb program, The link is in my bio. Also, make sure you subscribe to my email list, okay? You'll get a free training. Subscribe to my email list in case you have not subscribed already. And that's pretty much it. You can also click the link in my bio to subscribe to my email list as well. Follow Sasha Ladies, it works. Yes, thank you, Marsha. Marsha's not even in the program. She's only in my plant-based wellness membership. This stuff works, ladies. This stuff works, but you gotta do the work, okay? And if you need help, I'm here. The ladies are killing it in the Detoxify Your Womb program. Literally getting rid of 6 centimeter fibroids and getting rid of a whole 6 centimeter fibroid in 3 months. Like, that's crazy, okay? So love you, ladies. All right, if you need anything, go ahead and message me. All right, check out the link in my caption, and I'll talk to you guys later. Bye.